Buckinghamshire is a project specifically set up to reach communities, and we intend to do this by engaging actively with these communities, and the communities are the Afro-Caribbean community, the Asian community, the Chinese community, the Polish and the Irish, whatever minority groups there are in the area, we intend to engage with these communities.
I've been coming for maybe a year or more, and I get to meet a lot of different people and enjoy the craft and the exercise, which I like very much, especially the jazzercise. It keeps me young.
The benefits are fantastic. People come along, we aim to improve their balance, their strength, their flexibility, their confidence. It becomes a real social environment. People make great friends here. They really enjoy the exercises.
Well, I really basically want to get fit because 2 or 3 years ago I was expected to die, and I was in the care home for a year, and now I'm in a residential home, and really I want to move on, and I'm trying to get fitter still.
Well, basically, I tried patches and I tried inhalators and all these various different forms of NRT. Before I went to see the advisor, I just couldn't do it. I don't know why. The first time round I was really strong. I think I was younger, less weather beaten, a bit more oomph about me. So anyway, I kind of struggled. So I saw the advisor, saw Nikki. I'd heard about these tablets, and I actually suggested and brought up the tablets, and then the advisor was able to sort of help me out, sort me out, and get me on track, get me on the path. And brilliant, absolutely brilliant.
I had a letter through the post.
And what did you do when the letter came through the post?
I'm ashamed to say that I threw it into the dustbin, and my husband persuaded me to take it out again, because he thought it was very unfair that a screening programme should be happening and people were just throwing things away and not taking part. So I took it out of the bin and I filled all the little ticks and I sent it off, and I then received a kit. They phoned me up and asked me to go to Stoke Mandeville, or said would I like to go to Stoke Mandeville, to talk to one of the screening nurses, which I did. And she said, I would advise you very strongly to have a colonoscopy, but it's up to you. And I said, well, quite honestly, I don't have any bowel problems at all, and never have. She said, well, the sample that you sent was showing abnormalities, and therefore we would advise you to have a colonoscopy. And if Philip hadn't made me take that letter out of the waste paper bin, I probably wouldn't be here now.
Yeah, the cancer vaccine comes in 3 sort of booster jabs. I had mine between about January and June this year, and so it's not all in one go, which is nice. Parents at the foundation want the best for their kids, and by allowing them to have the cancer vaccine, they're giving them just that. And so even though it might be embarrassing or something you don't want to bring up with them, the parents are going to want their kids to have them, and at the end of the day it shows maturity on your behalf to have that conversation with your parents. Well, I can just sleep more easily knowing that I've had the cervical cancer vaccine, and the chances of me getting it at some point in the future are very minimal.